You're wondering why it says pulmonary TB? It's because tuberculosis can affect other parts of the body, meaning it's not limited to the respiratory system. So the same organism can affect your joints or other organs in the body. But for this chapter, we're talking about pulmonary TB. So you've heard about this, and you are required as healthcare workers to have TB screening annually. Who still gets PPDs here? Okay. So who gets the quantiferon gold? All right. Who gets chest x-rays? Okay, so just me. All right. So tuberculosis, this is no longer a third world problem, although it's endemic in the third world. Countries like the Philippines, Mexico, most South American and South African countries as well, Caribbean. Okay, so these are endemic in those areas, meaning all children born in those countries will be vaccinated against tuberculosis. Okay? During the first 30 days of life, they will receive their BCG vaccine in order to protect them from pulmonary TB. Because of the increased travel, it's not so easy to move around now. It's easy to go from one country to another. So it has spread to first world or advanced countries as well. So we have TB problems here, especially in certain areas. So first, let's talk about the transmission and risk factors, meaning who are at risk for TB. So once we know who are at risk, then we will have to screen and test those patients, right? Because they're high risk. So that includes us and also our nursing home patients, among other certain people. So how is it spread? Airborne. So it's not contact. Okay, so it's simply breathing the same air as somebody is. Okay, that's how it's spread. So if somebody infected with TB, meaning they have active TB, you have to have active TB in order to transmit it. If you have TB, which is the latent or inactive form, like what I had, you are not infectious because you have no symptoms. You have to be symptomatic in order to be infectious. So if you have latent TB, you have no symptoms, then you are not infectious. So how is it spread? Okay, talking, coughing, sneezing. So whenever the droplets leave your mouth or your nose and spread through the air, because the organisms are less than 5 microns in diameter, they're tiny enough to float in the air and spread. So it could be in a train car, in this classroom, or it could be inside any other enclosed vehicle, right? Or closed spaces, for instance, like prisons, nursing homes, rehab facilities, psych mental health facilities, okay? So anything that has close quarters, okay? Schools, including schools, okay? Classrooms, including ours, okay? So these are areas where tuberculosis can be spread. The organisms is so tiny and it does not cause acute symptoms for most people unless you are severely immunocompromised. Okay. So they sit quietly in your lungs, in your alveoli, and then they multiply. How they the how they end up infecting and causing symptoms depends on the patient's immunity. So let's go now to risk factors. So who are at risk for TB? Meaning, if we remember the chain of infection, what is this referring to? The susceptible host. Okay, so it's not just any host. So therefore, is everybody at risk for tuberculosis? No, there are only certain people who are at risk. Everybody can be exposed, but will everybody exposed be symptomatic, be infected? No, not necessarily. Okay, because so here are the risk factors. So people who live with or have any close contact with somebody with active TB. And we emphasize it's active TB. Who are considered active TB again? People with symptoms. Okay, people with symptoms, acute symptoms, and they have active TB. So inhale the organism again through talking, sneezing. So somebody coughs, sneezes, talks, shouts, sings, whatever, and you inhale the the organisms, and you have one is immunocompromised status. For example, you have HIV, you have cancer, you are a transplant recipient, or you have a condition that requires you to have long-term steroid therapy. We'll discuss steroid therapy next semester. And also, we'll have one example today, which are COPD patients. Okay, they have, and later for exam two, we have rheumatoid arthritis patients. They are also on steroids, okay, some of them at least. So they are immunocompromised. Substance abuse disorder. Now, don't take this the wrong way. If I'm an IV drug user or alcoholic, doesn't mean that I will contract the TB through IV. Okay, so tuberculosis is not transmitted intravenously, nor is it transmitted through alcohol or through contact. It's still airborne. However, what can you say about people who have who are IV drug users or alcoholics? Do they really have the best judgment? Do they hang out with the best people? Or do they congregate in crowded areas, people who are symptomatic with TB? So that's how substance abuse persons are at risk for tuberculosis. Do you get that? It's not because it's transmitted intravenously or through alcohol. All right. That's the reason they're here. Um, Homeless patients. Okay. So poor, because what can you say about um, people living in poverty? Where do they live? Crowded areas, right? Or let's say homeless people. Okay, so they're in crowded areas, dark areas, right? Or let's say the projects, for instance. Okay, so good thing in New York, our um, um, public housing isn't as bad as those in, let's say, Chicago or Michigan, for instance, right? So it's not as bad. However, they are still a little crowded, yeah? So you still have enclosed spaces and then you still have exposure. Pre-existing medical conditions, we just finished CKD. We're talking about diabetes recently, malnourished, because what happens to your immunity when you have these conditions? Decrease, right? Decrease immunity, or you are exposed again to people who may have active TB. Immigrants. Now, this immigration here must be recent. Okay, so recent as in the last 5 years. So if you're an immigrant living here for more than 5 years, you are no longer high risk. Okay, I mean you've been here already. Okay, so you must have immigrated within the last 5 years from these countries and the other countries I mentioned earlier. Again, institutionalized patients in a prison, nursing home, rehab, mental health facilities, or group homes. I already mentioned about overcrowded, substandard housing, or you are a healthcare person. Um, who are healthcare workers here? Only Pironsky? Only Benitez? Only Janelle? It's actually all of us. Because you may not work there, but have you been to a hospital? Like once a week for 14 weeks? Yes, you're considered a healthcare worker already. Right? So you've been, and how many semesters have you? This is your fourth semester. So you've been in clinical often enough to be high risk. Okay. So that's why it's required that we have annual TB screening. Okay, before we go to manifestations, let's finish the testing first. I know what that's under diagnosis. We'll look at that later. I'll take you to the CDC website in order to know how to interpret the PPD. Okay. So how do you search the information? So you just type in CDC, PPD, um, so CDC, PPD interpretation. It should give you a fact sheet um, right here. I don't like this one. Let's look at another version. Don't worry, I'll send you the link. Right here, the fact sheet. It's the same thing. All right, they changed it now, so it looks like this. Okay. So you just because the old one was in 3 columns, now it's I guess this is the new fact sheet, but the information's the same. Okay. So we group people into three. There are three possible positive. What's the positive reading, by the way? Is it the area of redness or the induration? Induration. Okay, so how much is the raised area? For example, in 2004, when we came here, so we get PPD, we also get tested for PPD back home. Okay? It's not just when we come here. So annual PPD. So we've been negative since back home when we're working in hospitals, we've been negative. When we came here a year after, so one of my colleagues, also from the Philippines, she had a reaction to the PPD, probably because there was another ingredient they use for the PPD here. So she reacted, so her whole arm from her wrist all the way to her shoulder turned red, but there's no induration, meaning the area was here, right? So it was planted here. Nothing was raised. The whole arm just turned red. So is it positive or negative? It's negative because there's no induration. The whole arm just turned red, but it's not redness that we look at. It's the induration. How much is the raised area? Does that make sense? Okay. So if there's an induration of 5, 10, or 15, it's positive if, number one, 5 or more is positive in these people. If you live with someone with if you have HIV or you live with someone who's actively having TB, who has active TB. X-ray shows that you have TB or organ transplants or other immunocompromised people, meaning if we test these people and they have a 5 millimeters or more induration, then is it positive or negative? It's positive. Okay. What about 10? 10 is positive in these people. Immigrants, IV drug users, alcoholics, laboratory workers, because they handle the specimens, right? They handle the sputum specimens. People who live or work in institutions I mentioned earlier, certain medical conditions, chronic medical conditions, malnourished. This is the low body weight, that's malnourished, or young children below 5, meaning if you test these people and they have a 10 or more, is it positive? Yes. All other people in the community who have none of these risk factors here, meaning they're not HIV positive, they don't have any immunocompromised status, they're not alcoholics, IV drug users, they've never been to a nursing home or a hospital, they have to have a 15 or more in duration. Okay, so again, where do you guys belong? When are you considered positive? So let's say Chelsea has an induration of 15. Is it positive or negative in Chelsea? Again, Chelsea 15. Is it positive? Positive, because how much does Chelsea need to be for in order for her to be positive? 10. It's already 15, so she's positive. Does that make sense? Okay. Let's say I'm 8 years old. I live in Paris. My parents are artists. Okay. My father's a trumpet player for Philharmonic, and my mom is a, painter in the museum. They tested me for PPD. My result was 8. So where did I belong? Am I a 5, 10, or 15 to be positive? I'm 8 years old, living in Paris. My parents are musicians and artists. So what am I? Am I 5, 10, or 15? I'm 8 years old, and then my PPD result was 8 millimeters in duration. That's a negative because I need to be 15. Why do I fall under here? I'm 8 years old. I'm a 15. Okay. Any questions about that? Okay, so I gave you the examples, all right? So next week you see because that's how it's gonna be. So you see patients and then you ask them, okay, you interview, where are you? What do your parents live? Where do you live? What do your parents do? And then that's how you interpret the PPD. Uh-huh. They belong under 15. Any questions? Remember, your exam questions are application levels, all right? You still have a few comprehension, recall, a few of those questions, but mostly it'll be clinical application. Okay, so who are considered having active TB and are therefore infectious? Well, people with symptoms. These are the symptoms. Now, because the organism lives for a long time, they do not cause acute symptoms. Look at the fever. The fever is only low-grade fever. And is the cough only a few days? No, this cough lasts for a month or more. They have fever, night sweats, fatigue, even weight loss. So if the patient has this profile, then they will be tested for TB. Again, what do we test? Is it the redness or the induration? Induration. All right. Now, there are a few tests that are mentioned here. First, of course, you're familiar with PPD and the um, quantiferon gold. Okay. All these tests, however, only indicate exposure to the TB organism. I repeat, if you're positive in any of these tests mentioned here, what's the only explanation? You've been exposed to TB. None of these tests will tell whether it's active TB or if it's latent or inactive TB. Does that make sense? Okay, what do all these tests do again? If you're positive, what does that mean? You've been exposed to tuberculosis. Can they ever tell whether your symptoms indicate active or inactive? None of them do. Okay. So we've got PPD. If you do have BCG history, meaning especially in the last 10 years, you've been exposed to BCG. Now, recent evidence tells us that the BCG vaccine, if you ever received that, does not provide lifetime immunity. Okay? The BCG vaccine cannot provide lifelong immunity. The vaccine does not provide lifelong immunity. We thought it did, but recent evidence says it does not. It wanes over time. All right. So meaning, yes, will I always test positive for PPD on the PPD if I receive a BCG vaccine? That's not true. Okay. Because back home, when I was born, I received BCG. But when I started working and I got PPD, it was negative. How do you explain that? Does that make sense? Okay, so I'm negative. Some people may test positive because of the birth BCG, maybe, but not all people will, right? So when I tested positive for PPD in 2005, because 2004 I came here, I was negative. 2005, I was positive. So what was the explanation? I was exposed. Okay, I was exposed to TB. So of course I said, I don't believe this. TB is everywhere in the Philippines. I never got it. I come here and then I get it. Okay, I get exposed. Okay. So if you've been given the BCG vaccine and then let's say you dispute the result, say, oh, that's because of my BCG. Well, we can do another test. We can do the quantiferon gold. We can do this one or the TB spot test because the quantiferon gold is not affected by the BCG, the prior BCG vaccination. So here, so these two tests are preferred diagnostic tests for people who have received the BCG vaccine or who are not likely to return for a second reading of the PPD test because these two tests are not affected by a prior BCG vaccination. Does that make sense? Meaning if you're positive with the quantiferon gold or the T-spot TB test, then it is positive. Clear? All right. So what happens if you do have a positive PPD result? So it's either 5, 10, or 15, depending on your profile. Let's see if it is active or latent. So the only way to test whether you are active or latent TB is to get a sputum sample. If you have no symptoms, will there be a sputum sample? Well, how are you going to give a sputum sample if you have no symptoms, right? So that means we'll have to do an X-ray. X-ray will tell whether or not you have active or latent TB. Okay, so if your X-ray shows there is a spot there, okay, you have black lesions, for instance, then that will confirm you have TB. Or maybe you do have spots there, but you have no symptoms. That means it may have been a previous old infection, okay, which you spontaneously healed somehow. So again, a positive reaction from PPD does not necessarily mean that active disease is present in the body. Are we clear? So it could be latent TB. So the sputum culture will confirm the diagnosis. Patient has symptoms, positive PPD, positive quantiferon gold. Now we get a sputum sample. Sputum grows the organism. Then is it positive? Yes, positive for active TB. And we will automatically isolate you. What type of isolation? Airborne, which is a negative pressure room. Okay. All right, let's go to medical management now. Treatment is 6 to 12 months. If you have latent or inactive TB, you can choose to be treated. You will be offered, though. The Department of Health will offer you treatment for even for latent TB. Okay. There's really no option for active TB. Active TB, you're infectious, you're a danger to society. You will be treated whether you like it or not. Are we clear? It's mandatory. Okay. So if you have a patient, let's say, who has active TB, and then let's say one of those people who say, this is America. I have rights. I am free. I'm free to refuse anything. Not exactly. Okay. So the Department of Health has police power, right? And you've seen it in 2020. What did the Department of Health do? Quarantine. So they have the police power to quarantine people. So if you refuse to get treatment and you are actively infectious, what can we do to you? You can be institutionalized. Okay. So for a while during your infectious period, you will be held against your will, all right? Until you comply with treatment. Because can you be allowed there to infect other people in society? Of course not. Okay. So there are certain limitations on the Bill of Rights. Okay. So your freedom of travel, of course, will have to be restricted. We can't have you do that. All right. And we'll talk about later how long you are infectious once you begin treatment. Okay, so 6 to 12 months of what? Okay, so there are different types of TBs. There are the Mycobacterium tuberculosis, which is the most common, but we also have drug-resistant strains. So it depends on the length of your treatment, and the number of antibiotics you'll be taking will depend on the organism that you have. Now, for testing purposes, we will only discuss the first line medications for the non-resistant strain. Okay, so this is regimen 1. So we've got 4 drugs for active TB. If it's latent TB, you will only be taking 2 drugs. Okay, now before we go to the medications, let's go to the um, period first. All right. So these are the 4 medications for active TB: INH, rifampin, PZA, and ethambutol. 4-drug regimen. Now, why do we need 4 medications to treat tuberculosis? Active TB. Is it easy or hard to kill? Hard. It's hard to kill. It's a very tiny organism, so we want to make sure we eradicate it. Okay. So, what's the treatment? So, page 549. All right, so what's the period? How long will I be taking this and how many drugs? Okay, there are 2 phases in therapy. Now, why are we talking about this? Because you're the ones explaining this to the patient. Okay, because who are these patients again that have active TB? Homeless, right? IV drug users, substance abusers. Okay, could be mental health patients, yeah? So are they like you and me, most likely? Are we drug users? Homeless? Okay, so are they likely to be like you and me? No. So can you trust them to, let's say, if you give them a prescription, will they take it on their own and then, come back for follow-up lab work? Not likely, right? Okay, so therefore, we need to make sure that these patients will comply. And in order to ensure compliance, you have to explain, well, how long are we talking about here? Okay, so there are two phases in the therapy, initial and continuation. The initial phase lasts for how long? It's 8 weeks. Initial phase will be 8 weeks, followed by another 16 weeks, which is 4 to 7 months. Okay. So therefore, how long will the entire period be? 18 plus another 18. So 26. Okay. This is 26 weeks at least. Some people will be prescribed, depending on, again on the strain, they could be taking this for 12 months. Okay. So let's say you have the non-resistant strain, and then your prescription is 6 months, technically 6.5 months because it's 26 weeks. Okay. So for 2 week, for 8 months, or no, sorry, 8 weeks or 2 months, you'll be taking four medications: INH, Rifam, PZA, and ethambutol, plus vitamin B6. Vitamin B6 is, we'll look at the table later why you're taking vitamin B6. Okay. But four antibiotics and then the B6 supplement. Okay. So they are once a day for how long? 8 weeks. Okay. 8 weeks. Nowadays, we have combination drugs now. So instead of taking four tablets, there'll be like one tablet, okay, containing all four medications, okay, or maybe two tablets, okay. So they're making it easier for patients to take. All right, so that's initial phase. How long again? Months. 8 weeks, okay, or 2 months, followed by 18 weeks of continuation. Okay, during the continuation, how many are we talking about? Only two drugs. Okay, so the continuation phase will only be two drugs, which are INH and rifampin, for another 4 or 7 months. So that's up to 18 weeks, right? Potentially, or even longer. Any question on the duration? Okay. So next question is, well, for how long am I doing this? What am I, so what if the patient who has, who said, I have my rights. Okay, I don't want to be, you can't force me to do treatment. Okay, so what do you say to those people? Are they really isolated for the entire 6 months? No, sir. Okay, so you're only isolated for how long? Okay, so let's look at when are they considered non-infectious. People are considered non-infectious after 2 to 3 weeks of continuous therapy, meaning does it have to be 3 weeks? No, because it says 2 weeks, 2 to 3 weeks. Now, after 2 to 3 weeks of continuous therapy, as long as they comply, are they still infectious? No. But can they stop taking the medication? They'll have to finish the whole treatment regimen. Okay, but at least do they still have to be isolated? No. What if, let's say, they live with people at home? What do we do? Are they going to be isolated in one room for the entire 2 weeks? Not really. Because likely, what's been happening in the household before we knew this patient had TB? Everybody was in the same room. So what are we gonna do? Get him another apartment? No. Because most likely those people he's living with, because what was the risk factor again? People who live with the active disease. So therefore, his family members or her family members, what are we going to do? We'll test those people as well. Does that make sense? Right? Because we can't avoid it. They live in the same house. So they fall under the risk factors, which is people who live with the active disease. So we'll do the same thing for those people. Okay, we'll test them. Okay, come here. We'll test you for TB. All right. And if they're positive, then depending on whether or not they have symptoms, they will have treatment. Latent TB is offered treatment, 6 months only, but two drugs. which is advisable because I mean this is inactive TB. Can it be activated later? Are you gonna stay? Let's say it's an 18-year-old positive for TB for PPD, but then no symptoms. Do they have active or inactive? Inactive or latent? Are they infectious? No, they have no symptoms, so not infectious. But are they gonna be 18 forever? So once they hit 81, numbers now switched. Can that latent TB or inactive TB become active TB? Yes, because they became a susceptible host. So at 18, they were not a susceptible host, but the organism is inside them, right? So later, when they do become a susceptible host, can they now get infected? Yes. Are they now infectious? Yes. Okay. So let's go to the drugs. So we tell them the period. So let's say the alcoholic. Let's say our patient is alcoholic. I'm your patient. I'm alcoholic. And you say, okay, yeah, I can handle that, I guess. So 2 weeks. What did you say again? How long am I taking and how many drugs? 4 meds for 8 weeks. Okay, and then what? How many drugs for 18 weeks? 2 drugs for 18 weeks. Okay, all right, I can handle that. Okay. Can I still drink? Well, this is the next teaching now. Okay. So let's take a look at INH first. So isoniazid, this one causes peripheral neuritis. So that's why you're taking what supplement again? B6. So here's pyridoxine, which is B6. So to prevent neuritis, because this drug will deplete your B6 levels in your liver, so you'll be taking B6 with the INH. Okay. So what do I need to know about this drug? Okay, well, you can't take alcohol with it. So no alcohol, because what will happen if I take it with alcohol? There'll be antabuse effect. Okay, so it will damage my liver. So that's why while on it, every month I will have blood tests drawn to check my liver. All right. Next drug, rifampin, affects oral contraceptives. So therefore, can I take oral contraceptives? What do I do? Something else, right? Condoms, maybe, or yeah, IUDs, whatever. Okay, can't use oral contraceptives while on this drug because otherwise it will not work. It turns my urine orange, but that's okay. Okay, this is a harmless side effect. What happens to my liver? Same thing, same as INH. It's harmful to the liver. So should I be drinking alcohol? No. Okay. And how do I know my liver is already damaged? What happens to my urine? Dark. Now, dark urine, is it the same as orange urine? These are not the same. When we say dark, it looks like soda, like Coke, Pepsi. Okay, that's dark, right? Like tea, that is dark color. Is any of those tea, Coke, Pepsi orange? No. There's orange flavor Pepsi, right? But it's not colored orange. It's still dark. Next drug, PZA, pyrazinamide. You can disregard the other two. They're really other versions of rifampin. So PZA, what does this drug do? Yes, it's still harmful to the liver, still monitor AST, ALT. Plus, it also increases my uric acid. So what can happen if I have high uric acid levels? It's going to cause gout. Yeah. So I'll have gout symptoms. My toes will be painful. So plus it will damage my kidney. So I need to drink lots of water while on this drug. Then last drug, ethambutol, causes optic neuritis, which can cause blindness. So as you see, the ethambutol does not have any liver issue, but it does harm the eyes. Okay, so that's why here you need baseline eye exam before you start this drug. Want to see because we want to see if there are any changes once you start the therapy. Okay, but still, I mean, the other three have alcohol problems. So can I drink alcohol with ethambutol? Well, technically it's okay, but I'm taking three others which are dangerous with alcohol. So no alcohol for how long again? 26 weeks, no alcohol. Now, is that easy for someone who's an alcoholic? So you can see how hard, is it hard or easy to ensure compliance? It's hard. Okay. So what do we do to ensure compliance? Well, we have a program for that. So right here, we have something called um, the rest of the interventions, by the way, are for um, non-pharmacologic, meaning we have here the no, will they require oxygen? Could they possibly require oxygen? Maybe, yeah, maybe. Will they require bronchodilators? Will they require teaching on how to do incentive spirometer? Okay. Will they require how to learn how to do deep breathing and coughing? Okay. How to do breathing exercises? Okay, so these are non-pharmacologic interventions. Okay, no different from anyone who have respiratory problems. Okay, so there's a program here. This originated in the third world because we have these problems, even bigger problems back home because addresses aren't like here, wherein you have streets. Okay, so back home there are slums. Okay, there are squatters, meaning they just build houses anywhere under the bridge, for instance, or any space, any open space they can find. This could be in the swamps. Now, are there street names in the swamp? Is there a street name under a bridge? And if there's multiple houses in the bridge, under the bridge, even if you say, oh, under the George Washington Bridge. Okay, so on the Manhattan side. Okay, whereas another set of houses under the bridge on the Jersey side. Okay, what if there's multiple houses? Are there house numbers? No. So that's a challenge, right? How are we gonna track these patients? Okay, so let's say they all live in a swamp. Yeah, okay, go to the swamp, but when you get to the swamp, there's 50 houses there. How are you going to trace the patient, right? So therefore, we came up with DOT, direct observed therapy. So patients who are at risk for non-compliance, let's say we got homeless people, for instance, so you don't know where they are at any given time, correct? So you incentivize them, and this is part of the program. So they'll be given transportation and even meal allowances for the trouble, right? So, okay, so here's a free meal. Okay, when you come, okay, so come here. Here's a Metro card. Okay, so we have Omni cards now. Okay, so here's an Omni card for, let's say this will be good for 6 months, right? So ensure you come here. Yeah, for the entire 6 months, you got 4 rides there. Okay, 4 rides a day on that Omni card that expires in 6 months. Okay, so you come here to my clinic. I'll give you the drug. Okay, I'll give you the medicines, and then here's a meal allowance. Here's a meal voucher also. Okay, so will that ensure compliance? Yes, that's a free meal right there, right? So I'll go get on the train, okay, go to the clinic. Okay, oh, hey, take my pills in front of the nurse or the doctor. Just like in prison. And then here's your meal. Okay, see you tomorrow. Okay, and then they come back for the entire 6 months. Okay, so that's what we do. A DOT. So that's direct observed therapy, meaning the patient takes the medication in front of the provider. All right. So you see how serious this condition is. Okay, so what that governments will pay for these programs, okay, to ensure compliance. Although back home we also have, because we do have people who absolutely are crazy that will not comply with the treatment, but we have to treat them, so they'll be put in a institution. Okay, we have institutions like that also. So our TB wards there, of course, they're off isolation for after how long? 2 weeks. Okay, 2 to 3 weeks of continuous therapy. We take them out of isolation. They can go out of the room now. But of course, we can't discharge them until they finish the therapy. Okay, so these are only for those select few that are just very difficult to treat, okay, because of their non-compliance. So ensure again, nutrition. Okay, so remember the risk factors. The patient has to be managed as well. Okay, because they have malnutrition, so improve. Because otherwise, will they ever heal? No. And transmission, we already talked about. You already know hygiene, right? I mean, how do you cough? Yeah, back of the elbow, or let's say in the back of the knee, right? You can do that. Back of the knee. If you can't reach the back of your knee, then it'll be somebody else's knee, okay? Back of the knee. All right, any questions on TB? Oh, how do we know that they're healed, that they were treated? How did we know that they had active TB again? How did we know they had active TB?
We did a chest X-ray,
Was it only the X-ray or sputum?
sputum test.
Okay, so how do we know it worked?
We have to do it again.
Okay, sputum again and chest X-ray. Okay. Will the lesions disappear?
Yeah.
No, because the cavities are already there. Okay, so the organism already damaged that lung. So you'll see probably scars, okay, but no more active lesions. What happens to the sputum culture? Okay, it won't grow anything. Okay, so of course that means the patient was successfully treated. All right. Any questions?